West Des Moines Chamber of Commerce's CEO Insight Series. We are so honored to be with Dr. Lynn Nelson today of Iowa Specialty Hospitals. And we're excited to learn more about Dr. Nelson, what you do, and your hospitals. So welcome.
Thank you very much for hosting me. It's great to be here.
It's so nice that you're here, especially being a doctor. I know how busy you must be. So tell us about Iowa Specialty Hospitals and all that you do for the community in the state of Iowa.
Sure. Iowa Specialty Hospitals has facilities in Clarion and Belmont, Iowa. We have multiple satellite clinics, primarily in north central Iowa. It's kind of two-pronged approach. They have a heavy primary care presence and a heavy presence in subspecialties of orthopedics and of weight loss.
Orthopedics and weight loss, okay. And tell us about the weight loss side of your business as well.
Iowa Weight Loss Clinic has a large presence in central Iowa. They've had an office just off of Jordan Creek Parkway for several years. Recently moved to this new office. Dr. Ibis is the surgeon who performs the bariatric procedures there. There's a large team of care providers, including nurse practitioners, physician assistants, dietitians, social services people, and of course clerical.
Big organization, it sounds like, yes.
It is. Big group.
Big group. So tell us about, as a doctor, what's your specialty? How do you help patients?
I'm an orthopedic surgeon. I specialize in spine work. So that is the diagnosis and treatment of spine pathology ranging from cervical spine, which is the neck, thoracic spine, the mid-back, and lumbar spine, which is the low back.
And that's your specialty, right? That's the only thing you focus on.
It is.
Wow.
Completed an orthopedic surgery residency back in the day, but specialize in spine only.
And you went to Iowa, I understand, right?
University of Iowa for medical school.
Nice.
Great medical school, as you well know.
I love it. And then after Iowa, you were led to Indiana and then Kansas City, is that right?
Right. I completed a standard 5-year orthopedic residency program in Indianapolis at Indiana University. Nice. And then a 1-year spine fellowship at Kansas University, which is in Kansas City, Kansas.
Wow. And you've been practicing for a long time, I understand.
I have. Yeah. Out of training in Kansas City, came to central Iowa back in 1994, so good. Approaching 30 years.
That's amazing. So, I think I can count many people that have back issues, which can relate to heavy lifting, work, play. Kind of tell us how you treat the spine. That's a huge issue that I think a lot of people have a problem with.
Sure. The majority of spine problems are treated non-operatively and resolved with symptomatic treatment. The surgical cases typically are divided into two broad categories, not quite that simple, but for simplicity's sake, one are relatively young people who have disc herniations that don't respond to non-surgical means and need to have a portion of that disc removed. The other are more older persons who develop degenerative conditions. Those degenerative conditions result in the overgrowth of bone and soft tissue to pinch on the nerves and in some cases cause the vertebrae to become unstable or move back and forth a bit too much.
What's the recovery time on something like that? Is there an average recovery time?
For a low back partial discectomy, most persons are back to full activities at about 12 weeks.
Okay.
Persons have restrictions lessening over time, but some restrictions for 12 weeks. For neck fusion patients, it's more like 4 or 5 months. For the low back fusion patients, 4 to 6 months at least. So relatively rapid return for those patients to light activities, but a quite slow return to demanding ones.
Yeah. Well, that's amazing that there's actually a cure, right? Because if you're in so much pain, I was on your website, there was a gentleman that had many tours in Vietnam, and he has a new lease on life because of the work that you've done.
Nerve pain can be absolutely debilitating. A very gratifying part of my practice is indeed helping those patients who have, in some cases, debilitating nerve pain, who experience not necessarily immediate, but marked improvement in time.
Wow, well that must be really gratifying work to see that change in people.
It is. It's a really great specialty.
Oh my gosh. So tell us about the future of the clinics and where you see the clinics going. I know there's a lot of growth in West Des Moines and in Iowa. Generally, tell us about the growth of your clinic.
There certainly is. My practice, as I said, is limited to spine. There's some interest in Iowa Specialty Hospitals of having some other specialists come here. I think that's going to be delineated in time. Certainly the Iowa Weight Loss Clinic continues to grow and get busier and busier.
Yeah, that's amazing. So tell us a little bit about you personally. What do you like to do? Do you have any spare time? Do you have any free time?
Oh, sure.
Okay.
Have a wife of, gosh, 40 years already,
Wow.
believe it or not.
Need to know your secret there.
Yeah, we
That's
have 4 children, 3 boys, and a daughter that's a few years younger than the boys. Outside of work, I have a farm interest in north central Iowa, spend a fair amount of time at that, and recreational interest, particularly snow skiing, water skiing, and biking.
Love it. Well, you can bike in central Iowa, you can water ski, yes. Where do you snow ski?
Most commonly Colorado or Utah.
Okay.
When the kids were young, we enjoyed the small ski facility up in Boone, Iowa.
Yeah, it's great. Yeah,
it's a nice
awesome.
place.
It really is. It's amazing. So that's wonderful. So anything else you'd like to add and tell our audience about today?
Oh, no, I mean, West Des Moines is a great place. I'm very happy to be back seeing patients here again and look forward to continued growth.
Well, welcome, and thank you for the service that you do. That is incredible. I might be seeing you, who knows, in a couple of years. So
Hope you don't need that.
Yeah.
Hope you don't need that, but thank you much.
Yeah,
Thank
yeah.
you much for hosting me.
Thank you, doctor. Really appreciate it. Well, thank you so much, everybody, for watching this episode of CEO Insights and listening more to Dr. Nelson and all the good work that he does for our community. Stay tuned for our next CEO Insights, and go out.